y'all see this okay?
It's perfect.
Okay, perfect. And then I'll let Lea go ahead and introduce herself just because she's a familiar face and name that I want y'all to know as well.
Yeah, hello everybody. My name is Lea. I'm a veterinarian from Germany, and I came to Texas A&M in the last month to work on this important project together with Dr. Aicher. And yeah, we're super excited to be here today and talk more about what we want to be researching. And yeah, thank you so much.
Perfect. And I want to thank Kelly Curry as well for being our biggest cheerleader and helping to get our name and our work out there. All right, so I wanted to go ahead and just do kind of a quick overview of this. And there is some research, some prospective work that Lea and I are going to be doing. And so I'll talk about that a bit, but I just wanted to orient you guys to this disease and to be able to talk about what this means. I am most concerned about this in Labradors to start. And I think part of that is because the fact that they love water. And so they've got what I think would be high risk lifestyle for this, but there's still a lot of questions to be answered about this. And I've had 3 different Labrador owners who have had their dogs succumb to this disease, which is what the outcome that I don't want for any Labradors. And each of them had said to me, I wish that my veterinarian had known about this. And we could have been looking for this sooner. So I thought no better opportunity than to bring that to the rest of the group. And my Labradors are wrestling in the background. I apologize. They waited for exactly this moment to do this. Girls. Thank you. All right. So for tonight, what I wanted to do was just to talk about what is this infection? What is this infection do to dogs? All right. I'm kicking them out. Hi, out, go, goodbye, scram. All right, 2 Labradors that will need a new home soon. All right, so what is the infection? What does it do to dogs? It just seems like a made up name. So I want to make it important and understandable to the group. Why do I care about this? What do we know? And more importantly, what do we not know? Which is why we need to do prospective research to figure this out and to be able to go from there and to tell about what we're going to do with our project. All right, so what is this? There is, just in case anybody here has any human medical knowledge or experience in healthcare, would be that there is a human form of this similar disease. So I'll explain that this infection is not directly transmitted from dogs to people or from dog to dog or from person to person. But the fancy term for this, what this disease causes in dogs or people, is called schistosomiasis. And so if you are familiar at all in people, there are parts of the world that are not developed countries like the US. And there are places that do have this problem affecting people. And approximately about a population, what would be about 25% of the population of the US undergoes treatment for this in other parts of the world. It's a water contracted disease. And so that's why most of us don't work in water and don't have to go and bathe and wash dishes and take care of our families and fish in water, but in other parts of the world they do. And so this is an infection that people get, and it causes a lot of problems. And we've learned a lot about how to treat dogs from what has been discovered in people. So dog owners, veterinarians were grateful for it, but this is a problem that the World Health Organization wants to eradicate in people. In terms of the commonality, and I've got this picture from a really important article that came out, but I'm going to make it relevant and put a Labrador here as the dog. And so this parasite is this really weird life cycle. And I bring this up not to make everybody become trivia nerds about this infection, but rather to understand how do dogs get this infection. So really the infection is supposed to be in a primary host of a raccoon, but dogs got in the mix. And so they can be the primary host, and the parasite has a life cycle there. They mate, they reproduce, they shed eggs. The eggs are passed in the feces, just like a lot of other intestinal parasites. And they are out in the environment. And then the eggs, if they make contact with water, this is a very strange life cycle, but if they make contact with water, then they immediately hatch and turn into this next life stage. And then they go looking for a snail. And then once they find a snail, Once they find a snail, they will penetrate the snail. Then they do the next part of their life stage in the snail. And then the snail sheds them back into the water, this is where dogs can become infected. And this life stage of the parasite called Cercaria, they can then go find a dog and penetrate the skin of a dog and start this life cycle all over again. So it's not a parasite or an infection the dog gets by drinking water or eating feces or just being around another dog that has it. They have to actually pass these eggs in their feces. The eggs have to go through this life stage. They have to show up in a freshwater snail. And then the snail then hatches it out and it goes and finds a dog and penetrates the skin. So it's a really weird life cycle. But as you can see, looking at this, it requires a dog, water, and a snail basically to have the infection stay. We used to, and a lot of veterinarians still, because this is really what we're taught, is it's a weird infection that we learn about for approximately 2 seconds while we're in vet school. And because of that, freshwater snail only occurs in certain parts of the states, that we used to think it only would occur in the Gulf Coast states and over along the East Coast. And then what happened was all of a sudden there were some dogs that got infected in parts of the country where these freshwater snails don't exist, and where these dogs had no travel to parts of the country where there was infection. And that was really important. So Indiana was one of them. Utah was another. But if you look at these, you can see that, I'm sorry, y'all, I'm gonna murder my dogs for just a hot second. Yeah. I'm mortified. I have not had them do that. Of course, they would only do that with a whole forum of Labrador experts. Why this is really important is if you think about Utah, one of the places where this infection was found was Moab, Utah. And for anybody here on this call who's been to Utah, it's not a place where you think about a whole bunch of water and swimming dogs. And what they came to find was this whole group of dogs became infected. 2 of these dogs died from this infection, and they did a postmortem exam and found that these dogs had this infection. And that really opened up everybody's eyes in that area and veterinarians to say, why do these dogs have this infection? That's just a weird Texas thing. That doesn't happen up here. And what they came to find was that these people all came into this neighborhood in Moab. It's a beautiful place. They decided that they missed having water. And so they went ahead and built a man-made pond. And all of these dogs in this neighborhood had access to this water, and they went in there. So a group of researchers went out there and they looked on the shore and they found snails.
Oh my God.
And then
I'm
they
about
were
to murder Kyle for real.
the
He will
infection
not stop
occurred,
calling me.
in these snails, and found that this infection was there in these dogs. And what was even more striking was that none of these dogs had a history of travel to Texas. But when they looked at the genetic information
At 7:30, Mom.
they found that they actually most closely resembled infection that had come from Texas. So it would seem that dogs traveling around the country brought it to this pond, and then they found that this other type of snail could actually be a part of the life cycle. And that was really important because it made it very clear that this infection could be anywhere in the country now. And so that was really important, and made it clear that perhaps dogs traveling from other parts of the country could bring this to other bodies of water and infect dogs. So what does it do to dogs? The parasite itself will actually penetrate the skin of the dog. Let me use a laser pointer here to show you. Okay. It's not showing up. Oh, there we go. Okay, so the snail's in the environment, sheds out this life stage, penetrates the skin of a dog, and then it migrates. It's very strange, migrates through the body, goes to the lungs, liver, and then the parasite shows up in these blood vessels in the abdomen, and they mate and they form eggs, and they form all this inflammation that occurs in the intestines and in the liver and sometimes other parts of the body. And that inflammation isn't supposed to be there, so it only causes things to go amok. And then eggs are then shed. And what's important to know is that whole life cycle, that very strange, very complicated life cycle, takes about 3 months in the dog. So from the time a dog gets infected to the time that they'll actually be able to test positive on a fecal test takes about 3 months. So it's not something where if a dog just goes swimming in a pond that could be infected and you try to test them today, it could be falsely negative. So you have to wait that period of time. And something else, so that inflammation that I referred to is something that's really pretty striking. So this is a belly radiograph or X-ray of a dog's abdomen. And this is a pretty normal radiograph. So you've got, these are all intestines, these little gas-filled black kind of tube-looking things. And then you've got liver and spleen and kidneys and bladder. And so all the things that are supposed to normally belong there. Over here is the heart and lungs, and the head is over to the left side of the screen. And what's really wild is that dogs that have this infection that create this inflammation, they can start to have all of this sort of mineralization that can occur inappropriately. And I realized that looking at radiographs of a dog's abdomen are not very easy to look at. There's a lot of stuff happening. But I imagine that folks can see there's all this white stuff that's here that's not seen on the left side of the screen. And it makes this outline of all these intestines here. So this parasite causes a pretty obnoxious and pretty worrisome type of reaction in the intestines and the liver. And for that reason, a couple things that are at least helpful about this is that when a dog has a radiograph like that on the right, now more veterinarians who are familiar with this infection can look at that and say, whoa, wait a minute, does your dog swim? Does your dog have risk factors? I'm worried that your dog could have this infection. And I've seen some dogs who have been diagnosed with this infection before they have any symptoms or sickness at all. And it was primarily because they had these weird changes on their abdominal x-rays. And sometimes in the case of this patient, for this particular one, this dog was actually very sick, but it led to a much faster diagnosis than waiting for a fecal test to come back to start treatment. So that's been helpful. But overall, the symptoms, so how would your veterinarian be able to suspect this? How would you suspect this as an owner? Would be thinking, is there diarrhea that's unexplained, vomiting? Is there unexplained weight loss? Even if a dog has been eating relatively well, or a problem maintaining body condition, or does the dog have a poor appetite? And I think, you know, the majority of Labradors are extremely passionate about food. And so a change in an appetite for a Labrador, even if it's a small amount, can be very suspicious and worrisome. What's also interesting is that for dogs that have been infected, now we make a recommendation about screening another dog who lives in the house, because there's so many housemates of dogs that have been diagnosed that also have infection. And so our suspicion is they must have access to the same body of water, but we don't know that for sure. So we need to find out a lot more about that, because it shouldn't be transmitted dog to dog. So the assumption would be they have a shared exposure environment where they got infection. And what's also worrisome is that many dogs will get a routine fecal test, so something called a fecal float, when they go for their annual care. And that isn't able to detect this parasite because the eggs are so heavy. So it requires something called a fecal sedimentation test, which really isn't done that often. That's something also that we learn about in vet school and just don't do that often. But it's something pretty easy to do. There's certain labs that will do it. It's just not often done, or a PCR test to be able to find the infection. And how do you treat it? This is the part that's the hardest, is that if these dogs are sick and they're already feeling puny and their appetite is poor, they're having GI signs, is that they get a combination of two drugs that we use pretty commonly to help dogs treat them for parasites. But we use these for a longer period of time in higher doses. And these dogs already feel quite a bit, they feel pretty puny when they're diagnosed, if they're diagnosed when they're sick. And so these are drugs that make them feel even punier. And we're stuck between a rock and a hard place, because we need to treat the infection that's making them feel sick. And frequently the treatment that we give them makes them feel worse. And so these are dogs that it's, you know, it's just really hard on them. It's hard on their families. It's hard on the veterinary teams that care for them. Sometimes dogs can have a really bad reaction when these parasites die off, and they can have like an allergic or anaphylactic type of reaction. And sometimes that can be really severe. So in a perfect world, we diagnose this when they're feeling better, and we can maybe think about trying to do lower doses, things like that, have more time to be able to try to treat them. It just becomes really hard when they're sick and they already don't feel great. And we don't really know, we don't have a lot of information. There hasn't been a lot of research to be able to look and see, are these drug doses right? Could we maybe do a lower dose and make them not feel as bad? Could we maybe be a little bit gentler about giving them these treatments? Do we need to repeat it? And then I think the hardest part for folks who have Labradors is that the majority of them really love being in water. It's a big part of their quality of life, or it may be part of their job and what they do and how they interact with their families and what their main focus in life is. And so the idea of saying, well, just keep them out of the water is not really easy for owners. So that's the hardest part, is thinking this would be the safest way to keep them from getting infected. And I don't think it's realistic. So my thought is about, how do we better protect these dogs? Screen, look out for them. Is there preventative medications they could get, and kind of think about how they approach this in people. So I have a Labrador. She's like a heat-seeking missile for water, and spent all her time there. And so it made me think about that, so much so that when I got a second one, I named her after the lake that my first one spent all of her waking hours at when I was away from work. And coming to A&M, we see a lot of Labradors here. Obviously, they're a breed that are loved by many, but there's a lot of working Labradors that are in this area. I feel very blessed to be in this part of the country and have this kind of community around, where Labradors are a way of life. And many of these dogs, work in water for a living. And so coming back to A&M, and a place where this infection occurs more frequently than in other parts of the country, and seeing a breed that I love, that loves spending time in water, was something that really spoke to me. And I was interested. And then I had two dogs, one in particular that really made me very angry at this infection and made me say, okay, well, somebody's got to look into this. So these are two dogs. They belong to the same owner. They're litter mates, belong to a family that lives in the Houston area. And so Allie, this female, on the left, and Drake on the right, the chocolate, they're 8-year-old litter mates. And they both enjoy spending time in water and travel with their owner to duck hunt and such. And we diagnosed both of them simultaneously with this infection. This is Allie. This is after she'd been treated, and her hanging out in my office and begging for a cheese stick. So she did just fine with treatment. And yet her brother, Drake, this is him. He spent about 2 weeks in the hospital with us. His owner was incredibly dedicated to him, to whatever we could do. This is a parasitic infection. You'd think that we should be able to treat him and support him through this. And he developed a number of complications secondary to this infection that we have found in people in the parts of the world that are affected. And so it makes me think we have a whole lot more that we need to know. And when he said to me, I wish that my veterinarian had known about this, I wish that I could have tested before, I thought, you know what? Okay, well, let's answer that question. Let's figure out if that's the case. So I'm just mad. I really cared about this dog. I care about this breed. I want to support them in doing what they love. And this infection, it just seems like something that we've got to be able to do better on. So oftentimes we only know about dogs when they're sick, and that feels too late. And what's worse yet is that I think they're dogs where they're not even diagnosed because there's just not enough awareness about this, or maybe it's in parts of the country where people aren't thinking about it. So the more people that at least can put it on the table and say, should this be something we're thinking about, then that's already something that we're doing better for these dogs. We know that many veterinarians outside of Texas, so for example, in Utah, they weren't familiar with this. In Southern California, they had an outbreak on the California-Arizona border, the Colorado River. They didn't know about it. And so they're basically running to catch up, and a couple of dogs are dying in each of those instances. And so we need to get awareness out there beyond Labradors. Of course, that's the breed that we're all here for. But beyond Labradors, about 50% of dogs swim. It's something that is a common thing that dogs do, and people travel with their dogs. So I think that you can see where there's risk, and we don't screen for this infection as part of routine parasites. And in literature, just for dogs in general, about 20% of dogs are going to have intestinal parasites. So if they have risk and it's out there, then there's a reason to think that dogs could have this. And then it causes all of this problem. And so for Labradors, they already have certain diseases that can affect their liver, copper, chronic hepatitis, things like that. And Labradors are interesting in the sense that about 50% of them don't even have liver enzyme elevations when they have significant liver disease. And for these dogs, Drake and Allie, they didn't even have liver enzyme elevations, and their livers were both completely jam-packed full of this parasite. So for this particular breed, I become very concerned about this. And I'm concerned that this infection in people is associated with certain types of cancers. And so I just worry, is this something where maybe that's part of the reason why we need to be looking and treating, because does that reduce their risk of developing those? I work at the GI lab. It's a place where we have a fee for testing service for Heterobilharzia PCRs. I say that candidly so that nobody thinks that this is a conflict of interest. We're a nonprofit lab. We take the proceeds from any of the testing we do and reinvest that into research, which is how we can look into these sort of things. But this is a figure that shows the number of positive cases per year and how that has increased over time. And so I don't have 2023 or 2024, but they're even higher. And so what we need to know is, what's the prevalence? What percentage of dogs even have it? Am I just the lady who's saying we should care about this and really it's actually not out there? Should dogs who have high risk lifestyles, if they're spending time in water, should they be screened annually? Should that just be part of their regular visit when they go to their veterinarian? How should we treat it? Are there less aggressive cocktails, things that the dogs can handle better? Can we give them just something preventatively that would protect them, kind of in the same way that we give patients heartworm prevention or flea or tick prevention? Do dogs who get infected, maybe they have immunity afterwards and they're good to go? And other things that folks have asked, like, can we test the water for infection, or can we test the scales? Can we find ways to say this water is clear or this water is a problem? And again, how do we get veterinarians to know about this? I applied for AKC Canine Health Foundation grant at the end of October. That's a really long cycle before they review and approve, but I did reach out to do that. And I'd like the opportunity to be able to work with the AKC on this, because I want to try to increase awareness and be working with them on this. But regardless, we'll do this project going forward and have started to do that. But we're ultimately looking and thinking, our first step is thinking about what's the prevalence in Labrador retrievers, particularly those who have high risk lifestyles within Texas, a place where we know this infection exists. So what I proposed to the AKC was testing about 1,000 dogs. And I have 3 different populations of dogs. One are non-Labradors that spend time in water and live in Texas. The second group are actually what I call land-based Labradors, so Labradors that don't have high-risk lifestyles and live in Texas. And then specifically, the group that I'll need the most help for being able to recruit are Labradors that live in Texas and have high-risk lifestyles that spend time in water. And for all the dogs in the study, we would be gathering just information about them. Where do they live? Where have they traveled? What do they eat? What are their preventatives? Do they have any symptoms? And then to just have a voided stool sample. So it's nothing invasive, just a voided stool sample to be able to both test for Heterobilharzia, and then also as kind of a thank you for people participating to help them a little bit. And then also to see whether or not they might have other infections maybe that could be combined with Heterobilharzia, is just doing regular fecal float testing to look for parasites. So what we would need help with for the first part of this would be to find those 300 Labrador retrievers. That's what our statistician had said that we needed to do. If we exceed 300, that's awesome. But ultimately, that's what we need to be able to have the sufficient sort of power to the study to achieve that goal. And how we thought about being able to gather these samples are things like coming to club events, hunt tests, training kennels, private homes. I think that we can try to be creative about how we get those fecal samples. And again, all the dogs, they're going to poop, and we're just thinking about picking it up and looking to see if there's parasites in it. So it's really nothing invasive to the dogs. And I think this helps answer questions about whether we should be concerned. And ultimately, thinking about for Labradors and dogs in Texas, is there even any justification for looking at this? And is there any justification for thinking about how to look at this in other parts of the country, thinking about how often many of these dogs, especially in this area, travel to other parts of the country? And then also would be to say, well, what happens to these dogs? You know, let's follow them over time. What happens if they don't even get treated? Does anything happen versus those who do get treated and have a better understanding of what that looks like? So those are kind of the basis for the research questions and sort of the future things that we would be looking at. And so our plan going forward is we've started to collect samples from the other dogs, not the high-risk Labradors, but the land-based Labradors and the non-Labradors. And we're already testing those dogs. We have a whole separate population for that. And we are finding infection there. So my assumption would be that we'll also find it in Labradors. For those who we test, we would share the results with both the owners that enrolled their dogs as well as their veterinarians, so that that became a part of their dog's medical record, and that we can engage each dog's veterinarian in treatment decisions going forward, if that's what each owner had elected to do. And in terms of how we would move forward from here, for any owners that would be interested in participating in this, would be that Lea and I will share, we'll put this into a link that could be shared in the coming day or two, to have you reach out to just express interest and tell us a little bit about your dog. And then if we think that this could be a good fit for the project and you're interested, then we'll tell you about the next steps, including the questionnaire, how to be able to logistically get a stool sample to us, and go from there. And with that, I'd be happy to take any questions.
I have one question. Would it help, you know, being that Labradors are high risk and are always in these kind of water supplies, would it help to bathe them after they swim? Will that have any effect on whether or not these things can burrow in? Or
Yeah, that is a great question. I think that one of the things that's so weird about this parasite, and as I tell the story, is like all these things that have to happen for a dog to get infected seem wild. And so I think your question is a really good one. And as we learn more about these dogs, so in these questionnaires and things, the things that we'll have owners share with us, maybe we tease out something where these dogs have all the same risk factors, and yet this owner reports that they bathe their dog right after they've come out of swimming. And maybe we find there's some connection like that. So I would say that it's possible. And I don't know how quickly, you know, it happens from a dog having contact to having that burrow into the skin. Is it something that happens very quick? If it's something that sits on their skin and they come out after they get out of the water, I don't know. But I think that's a great question. And I don't know the answer to it.
but it couldn't hurt, in other words.
I agree. I can't imagine that it wouldn't.
Do
And
we know what kills these things? Like, you know, at that stage when they're burrowing in, like I mean,
Yeah.
do we have any idea of that yet?
So I don't think we know anything specifically here. So, you know, it's interesting here in the States, we're just thinking about the dogs, and not even that many people are thinking about this yet. And if we go over to a different part of the world, you know, in the underdeveloped parts of the world, they are thinking about doing things like treating the water. And so it's hard thinking, okay, well, is there a strategy like that? Could we take something from what they're doing in people, know that this water source is infected, treat it, and maybe it would be good for a period of time? But is there a way that we could do that that also doesn't hurt the dogs, you know, or hurt if people have like cattle or horses or something on their land, you know, that need to use that as a water source? Is that something that hurts them? So I think that that is possible, and hoping that maybe we'll have more answers to those kind of questions.
Thank you.
Thanks for the great questions.
Now, as far as preventative treatment, is there any recommendation for a dog who is, say, in the water daily? Whatever the medication is that treats it, is that just a a medication to treat parasites? And is that dangerous, or could you overtreat the dog?
Yeah, that's a great question. So I think that most of the dewormers are things that are pretty well tolerated by most dogs, but sometimes they can cause either side effects or that's additional cost. And sometimes there's enough
Yeah.
cost with taking care of dogs and doing it right and thinking about it that way. I think something that's really interesting is that one of the biggest drugs that is used to treat both people and dogs who have this is a drug called praziquantel. And it's not something, when we think about the drugs that are in a normal monthly heartworm prevention that dogs receive. So that might be something like ivermectin or moxidectin. And then maybe they also get pyrantel or some other part. And what that does is it basically prevents them from getting parasites is the idea, but doesn't actually treat the infection. And really the majority of those medications don't actually contain praziquantel. And I wonder if, thinking down the road, if we can say the kind of steps to this are, is this something we need to be worried about? We went out, as opposed to just waiting for sick dogs to come to us, we just went out and looked to see, do these dogs have this infection? And if we found that to be the case, and this is a emerging problem in dogs, then maybe we can say, okay, we need to come up with some strategy. So if, let's say, I'm somebody who my Labradors are going to swim year round and I don't want them to not do the thing that they love, then maybe I end up doing praziquantel, 3 or 4 times a year, something like that. It's my hope that we might be able to use this to develop a proactive preventative strategy rather than just trying to catch up once dogs have an infection and get sick.
I have a question. I have 2 ponds on my property. Is there a way to test the water itself? I know you mentioned that in undeveloped countries, they test the water and say, oh, this pond, this body of water is infected. Can you test? Do we have that ability here in the States?
Not yet. However, another one of my colleagues, so another veterinarian, his name is Francis, and actually that's going to be his PhD project. And so what he's going to do is be able to take the PCR tests that we use on feces or stool and see if we can maybe use that to test water. Can we test that life stage of the parasite that swims and penetrates the dog's skin, so that owners could be able to say, okay, I've got a water sample, I'm going to send that in for testing. And it's hard because a lot of ponds, it's, huge volume of water. And if we sample it, it's just a small amount. And does that tell us enough? So another thought and an area that Francis is going to spend time looking is actually seeing if folks can see snails on the shore of their property, could that be something that we could use that test to use? So that's what he's going to be spending the next couple of years working on, which I know doesn't help us right now, but clearly there's a need. And that's something that is such a good question and a really appropriate thought to have. And so we're working to try and see if we can try to answer that question.
Okay.
Yeah.